I definitely didn't fall so into it the second time where I was like going to like have my baby. Like I knew to like for a Tolac situation, to be honest, I had heard from enough people around me for my first baby. Like had I did ultimately have an OB and go to the hospital and had my C-section and stuff like that.
Yeah.
I didn't frown at all upon people having home births. I thought it was like a perfectly safe option. It was like, well, not for me, but I think that's fine for people. Like I didn't think anything of it really.
Yeah.
And so I will say I did know enough with like the Tolac piece, like, okay, that puts me in a high risk category. I shouldn't do it at home, but I disliked my C-section recovery the first time around. And I felt crappy enough from that delivery that I really did want a VBAC badly. And I did had a Pinterest board dedicated to it. And I pinned different, and a lot of it was natural childbirth stuff. And it was like, have a doula, don't get an epidural, make sure you do X, Y, and Z. And I had a balance with it. So I think the only reason why I lucked out was that I did I knew I had midwifery care, and I thought, okay, they're going to do whatever's evidence-based, but they'll still keep me safe. So I listened to them and they said, look, Megan, here's what we do. Here's our Tolac protocol. We want you to go to the hospital in fairly short order. We don't want you laboring at home for a long time. They were like, if you're early in labor and your contractions are pretty far apart, you don't have to come in right then. But like, we don't want to, like, once your contractions pick up, we're going to want to come in and put the monitors on you. We want continuous fetal monitoring. We have it so you can go in the tub and labor. You can't give birth in the tub, but you can labor in the tub if you want. You can walk around. We have the ones that are waterproof and you can move, the wireless ones. Yeah. And we do place, what is it called? The lock or the whatever, where they put the
saline lock.
Mm-hmm. So they said, we'll put the saline lock in. We want to place the IV because they just said, if something does go wrong, we want to be able to like quickly respond. It's just, you don't have a big window of time. If something like it doesn't happen often, your risk is really low. You're a great candidate. Your baby is 3.5. You are young, you're fit, you stayed fit this whole pregnancy. They're like, we don't have a lot of concerns about this happening to you, but we just want to be sure. So I did follow their rules, even though I had read and had some skepticism. Like, well, do I really need continuous fetal monitoring? And do I really, because I had so many resources telling me that was like unnecessary. So I like agreed to it, but was kind of side-eyeing it and then said like, whatever. Because I did kind of really not consider that, you other everything. You're just like, well, it won't happen to me. So, I mean, that piece of it, I think is the only reason why, but I'm honest now that while a VBAC wasn't like the be all end all, I was deeply hoping for one and so I did a lot of things to try to avoid a C-section more. So I guess I know that probably sounds like it's the same thing. I wasn't so much that I do think it's an important distinction that I didn't so badly want a vaginal birth, but I wanted to avoid a C-section because my C-section, so it wasn't that I was like, it wasn't this experience driven thing for me. It wasn't like, I need to experience. It was just that I didn't want to experience another C-section. So I was like, whatever I need to do to make that happen. So I did try the things that kind of make you eye roll now when you see them sometimes, because you're like, no, don't do that. But I did it. And I consider myself someone who's well educated and follows a lot of things, but I still was kind of like, no, like I'm going to try to drink this red raspberry leaf tea and I'm going to do all the rules of the VBAC VBAC facts checklist. Like I totally read Jen Campbell's garbage.
But it sounds, I read her reasonable. Stuff. And I think most people, when they're approaching it, aren't really saying that they missed an experience and they have to have this to be a parent. I really do think most people are reasonable and they think they're doing what's right when they follow those things. And they don't understand, the risk associated, because it sounds okay. And it sounds like, hey, if I can make this happen reasonably within my own power, then sure. And I think that's kind of the problem, because we don't have a lot of doctors and midwives, who practice in the hospital who say, look, this is it. And I get that you need to feel like you have control a little bit and that you could maybe tip the odds in your favor. I think it's really hard to get a doctor to talk to you in the way that you need to be talked to when you're, you know, you just would like to be able to have birth go a certain way and not have maybe a recovery that's super traumatic and just, you have to heal so much more and you have to think about your wound so much more. And I think that where it starts, it's not unreasonable, but then there's all these other things that get thrown in there and all these other practices, and midwives are like, yeah, you can control it this way, or it's a good way to do things.
Mm-hmm.
Mm-hmm.
No, I agree with you on that. And I think we do have that thing of there's like a gap of it almost seems like doctors aren't explaining the things that they could explain. Like if you had a doctor come to you and is like, if you don't do this, this is going to, like, if we don't do A, B is going to happen and it's going to be bad. Do you know what I mean? Like a lot of them really don't do that. As much as people have like this, we see with especially the natural community, they're like, every doctor wants to do a C-section and everything's fear mongering and all this stuff. But it's doctors are going in trying to do what they can to try to prevent certain situations from happening, trying to look at your charts, trying to look at other people's charts, because there's also other people that might be laboring at the same time as you are. So they're running room to room, checking everybody and, and all this stuff. But it's really hard to find a doctor that's actually going to sit down and go over like what's going on with your body and what the risks are for certain things. And I think like with a VBAC, for example, like a lot of women have it in their mind that they want a VBAC, but when they go in to talk to a doctor, they don't actually ask any questions. Like they don't ask like, should I have a C-section like planned out? Are we going to is there going to be drugs? What happens if I take an epidural? What happens? They're not actually asking any questions. They're going in saying, can I have a VBAC? And then the doctor will be like, well, you've had necessary years and you have the right proper scar. And, like they're looking at you like, of the paperwork, but then you're not actually asking other questions. Maybe they go, yeah, I think you can try and have a VBAC. And then you're like, yeah, I can. But then when it gets down to it, as you get closer, suddenly like when you actually are in the room and they're strapping you and they're doing all stuff and you're like, wait, I'm having a VBAC. I don't need to be monitored. And I want to do whatever. Like there's the other part where they didn't explain, by the way, in order to have a VBAC, you need to be continuously monitored. You're going to have this on you at all times. Like, by the way, if you have certain symptoms of labor, water breaks, like, whatever, this, like, these are your list of whatever, any that happens, you're going to the hospital immediately. Like, these are things that they don't really explain for some, like, I don't know if they're just so busy going in and out. Maybe there's just, I think part of it kind of is like they're medical, like they've spent a career, you know what I mean, years like doing all this medical training, getting all this education. So when it comes down to us, where we're like, we don't know anything, we're just having our baby, we're only in here for like a few months, really. It's like the doctor, like certain doctors, I think, will sit down and explain things if you ask them. But then certain ones are kind of like, how do I explain this from this medical term that I know to explain it to you so you will understand without me scaring the crap out of you? Like
or even, like if I see a lot of questions, would you drive an hour and a half for 2 hours to have a VBAC? And I'm like, I feel like that'd be a basic thing that I would ask my doctor. Hey, is that possible? I mean, you might not have terrible contractions. You might just like, I don't know, be in the back seat of the car or something. But do doctors ask about your distance from the hospital? Are they explaining that every minute, once you've got those contractions going, you have to be monitored? It's just a safety thing. And it's not like this big, huge something. It should just be part of the package. Like, this is what we do. And I understand that healthcare is something that is hard for a lot of people to access in this country. So it may not be like a choice all the time. And it may not be about having a VBAC at a certain hospital, but I think if doctors asked, they may be shocked by what they hear that they're willing to do for that.
Very true. Very true. I when I moved up north, because I was like, I could have had a VBAC. My doctor was like, well, you're a perfect candidate. Like everything, I don't have anything wrong. I'm like completely healthy. Everything's good. I've had a long enough time. By the way, one of the things, I was checked out down here and then up there, they checked my scar. They checked to see if I was like healed. They checked whatever. And a lot of the doctors down here knew the doctor that did my C-section, and they know exactly how his work is. So that was another thing. They were like, yeah, I totally know that's a good, that was a good C-section kind of thing. And I was like, okay. But when I went up north, the doctor was like, yeah, she checked me out and did all this stuff. She's like, yeah, you're a candidate. It's really up to you. Well, from the hospital that I was delivering at, I was about 2 hours away. And we thought as like a couple, we were like, the start of labor, even if you're just starting to get contractions and then having to drive down through the country, bumping on the road in your car, like, I was like, that just doesn't sound like a good idea. What I'm saying? Like, the road is not the best. It's like literally you're on like a 2-lane road. Like, here's us going and the traffic's going this way. Like, we get sometimes behind semi trucks, and you know what I mean? And I was like, and we have to go through little cities where we're doing like 15 miles per hour and stuff. And I could be like at one of those little cities where I'm like, I was like, no, I don't want to be like one of those like wacko situation movies where, you know what I mean?
Where you're having the baby on the side of the road or something. Yeah.
I had friends that happened to. Seriously.
Delivering my baby.
Now, I know our friends that had their baby in the car, she had it timed. She said, I know how long it takes to get to the hospital. I've had 2 babies before. When the contractions get to this point, we will get in the van and we will go. And they had no intention of any birth outside of a hospital, because that's not where her mind is. She likes the Chuck's pads and the hospital gown. She doesn't want her own stuff messed with. And she said because she wasn't expecting it to progress in that fashion, she didn't understand she was going to have to pull over in the Walmart parking lot, and they had to call 911, and baby was born before the medics got there. And she said it was the most traumatizing thing that had happened, even though she's had 2 other babies, that like, it wasn't the setting. It wasn't how she wanted things to go. Cause her husband's like, if I speed, we'll make it, we'll be fine. Cause she was saying, man, this is going faster. And yeah, she said, nope, pull over. And I was thinking there's a lot that can go into, even if you plan your VBAC to be a certain way, or you plan a birth to be a certain way, there really is nothing you can control.
You're right. But I will tell you that a scheduled C-section is pretty awesome. Like, I can tell you that actually, I felt more in control with planning a C-section than just hoping that my baby would pop out, I guess you could say, like sometime or whatever. Like looking at the differences of my pregnancies, the difference of my births, I can tell you that my C-section was so much better on every single level. The pregnancy was so much better on every single level. But one of them I can remember when I got toward the end, the first off, it felt like forever. And second off, it was very pressured. There's a lot of pressure. But the next time, it didn't feel like forever. It kind of almost felt like it was getting up really quickly. And it was like, I don't know. All of a sudden, here was the baby. And it was, I don't know, it's a whole nother experience that I can just tell you was just so much more pleasant. And I was involved. It was planned. And by the way, I almost thought my baby was going to come early by a couple weeks. And when I was rushed over to the first time, I panicked. I was like, oh my God, it's happening again. And when I got there, they were so ready for us. And I realized how different it is being in with a midwife, having home birth. They don't know you, they don't have your stuff. But going to the hospital that I was already pre-registered for, even though my C-section was a couple weeks later, here I was going to labor and delivery. They were ready for me. They had my file. They knew who I was. They had everything, whatever. So I could walk right in and be admitted right into a room so they could check out baby, check me out, and not have to sit and do paperwork and not have to do anything. Like, I was right in, like I was just in, this is where I was going. And they were super awesome about it. And I was like, oh, and they were like, it's only a couple weeks sooner, because I was like, am I going to have like my baby? Like, am I going to have a VBAC? And they were like, No, we would still have C-section. Like it would still be a planned C-section. It would just, you're having signs of labor. And so we're just doing it a little bit early. And so I was like, oh, okay. That's a relief. Because at my mind, at that point, I was like, I was having a C-section. So of course I was like, I can't have this baby this way. Be back. Like you started panicking. And like literally, I remember like when I left her office, we come out to a light. We went to a light, and there was like another light, and there was the hospital, and we had and I was still like, like it's just like that panic like takes over of like what you expect in your brain, which really let's be real, like what you expect is like being pregnant or your labor like has so much to do with so many things. It can determine if you have a good experience or a bad experience, because if you expect something and it turns to something else, it's different. But I can tell you, they were so ready for me. Like, I don't know, they must have known everything because they were so kind. They literally, there was like a lady waiting because my doctor called ahead and the nurse was like waiting for us. And she just was like, ding. And they literally took me back and they were like holding my arm, like, you're fine, everything's good. And they were just so like, so calm and so great. And so it was just such a great experience. Like, I can't even tell you, it was such a great, I did go back a week later. They sent me home and then I went back a week later, still another week. And they, it was great because they were like, so since you were here last week, because it was the same ladies, we're going to put you in a gown and we're going to get your IV ready because you might be having. But the next time I was ready because at that point, my doctor had talked to me on the phone, and after I got there, and the nurses had explained, even though it wasn't the date that I planned, it would still happen as planned. So then it was like a relief. So when I went back the next week, I was ready. I was like, I'm getting my C-section today. And then they were like, we're going to send you home. And I was like, are you sure you're going to send me home? I'm pretty sure it's like, it's day, it's happening. Like, let's do this first. And so, no, but they did send me home. And I had an awesome time too, but for sure I was like, my baby's coming early.
Actually, I think I remember that day because it was like 2 times in a row that we were like,
and I was like calling my family, like, what? Away. It was kind of one of those. It was pretty.
I think that's so it illustrates what good trauma informed care can look like, though. Like the fact that they knew your history and they knew like they just treated you, they had good trauma informed care. And I have a really good primary care physician who's like, he puts all other primary care physicians to shame. He's so good. And he knows very well, like, how he was like one of the first people I was really honest with when I was really struggling with my mental health after Thomas. Like, I felt like, because like a lot of people, when you have like postpartum mental health, you feel like you're going to get your baby taken away from you and you can't be honest, you have to kind of fake it. And so when I was really struggling, he was like, I did go to an appointment with him and was like, it's fine, everything's fine. And then I could tell he like was skeptical. And then I ended up writing him an email after and was like, I'm actually not fine, but I didn't want to say it to you in the office. I'm really struggling with XYZ. So he was really good, but he knows that I get really like, I have a very small threshold now for like providers if I feel like they don't listen to me, if they're being dismissive, regardless. So it doesn't even have to be OBGYNs. It can be like literally any specialist. It could be a podiatrist. I don't go to a podiatrist, but I'm just using it.
I was just thinking podiatrist.
It could be a podiatrist. If you didn't listen to me about my ingrown toenail, like I'll just leave. So like I had like an OBGYN shortly thereafter that I didn't feel like was listening to me about things. And I just was like, well, I have to find a new doctor. And I did. I immediately, like, I had no threshold for it. And it would be like deeply upsetting to me. So he knows like that's like a trigger of mine, is like not being heard by providers or not being listened to, because like in my labor with Thomas, I tried to tell people for like a while that something wasn't right and nobody was listening to me. So then by the time it turned into like this catastrophic uterine rupture, so my whole brain kind of associates things like, if you don't listen to me now, this is going to be an emergency, whether it's an emergency or not. And I just am offended. Like, if people just listen to me more, if doctors listen to me, and I have a great respect for doctors. So it's like, it really is a thing. So I don't know what he's done. He put something in my charts, because no matter where I broke my leg, I had surgery. They were so good. It was the same hospital that I was in. They were like, I know that you've had like they read, I know, I'm so sorry. They were just like so nice. Like, the nurse prepping me, she was like, I used to work upstairs in OB. And she was kind of like, I saw your chart. We'll take good care of you. Like, she was so like, they were just so that way, just so like very like that way. He specifically, he's very just like, yeah, he's like some cardiologist. I have small, very minor, but I do have to see a cardiologist. And he was like, cardiologist. He's like, doctors, they like go between the specialties and they stereotype each other. And he was like, they're not always like the friendliest bunch. I have this really specific one I went to residency with, though. He's like, you're going to go see her specifically. You're going to see Rebecca. You're not going to see the rest of them at that. You're going to see this one, because I can account for the fact and vouch for the fact that she's not going to be that way with you. And so sure enough, she was that way. And then I did end up landing on like an OBGYN that he knew, and he was like, she's going to be a good fit. And then like, she was really great. So even when I got my IUD in, she told me everything she was doing. She was like, this is going to have a little iodine on it, and this is going to do this, and then this is going to be, and she told me before it, she said, I know your history. She said, you might have like a lot of uterine scar tissue. I'm not quite sure. She said, so if I have even a little resistance in like putting this in, I'm going to stop, and we're going to do it under an ultrasound, and we'll do it. Like, I'm not going to force anything. Like, she was so good. And she was just like, this might be like uncomfortable, but it's nothing compared to like everything you've gone through. Like, they are so good that way. I've had such good, I do think having a primary care physician who's kind of just put it out there, like, don't be that way with her. And I appreciate it though, because I really do need people to have that PSA about me before I come in. Because if I have to be the one to tell you, it's going to be a bad sign. So
it almost shouldn't be your job to have to do that. Like, your care provider should be able to say, okay, this is the kind of care that my patient needs. Mm-hmm. Provide what they need.
And I do think that's what he did. Like, I don't think it was like in this like condescending, like, she's high maintenance. I think that he kind of was like, put it out there, she's experienced trauma. She has post-traumatic stress disorder. Please like listen to her and hear, like gentle in your approach. I really am. I do need people to be very like kid gloves. You can't have abrasive bedside manner with me. It won't work. I know that there's really good doctors out there who have abrasive bedside manner, and they can save themselves for people that have thick enough skin for it. I don't. It's traumatizing to me. So I have to have people that are really like warm and fuzzy. I need warm and fuzzy doctors that are nice to listen to me.
There are people who like a doctor who is gruff and to the point and doesn't really care. And there are people who really love that. I have a friend who is a lost parent, and it was her first child. And her OB through the whole pregnancy had been like that. And she loved that doctor because she didn't have there wasn't all this emotional stuff because she couldn't handle it. And when they found out the baby had passed, she's like, she was the perfect doctor for me because it wasn't all these feelings I couldn't handle at that point. She was perfect. And so that is my wish for everybody, that they could have a care provider who was what they needed, as long as it's somebody safe, that their bedside manners, lends itself a lot to that good communication. You're going to pick up on things. You're going to be a better patient if you feel like you can say stuff to your doctor the way you say it, not have to change it in your head. And if your doctor says things so you understand it.
Yeah, exactly. And I will say, he came to see me when I was hospitalized after Thomas, and he didn't he was very pragmatic. He was like, what information can I tell you? Like, what can I look up in your chart right now and explain better? He's like, I won't have all the answers. I wasn't there with what happened, but he was like, maybe some of the things about Thomas, I can he's like, I understand what his lab results mean. I understand these things. I understand like your blood loss. I understand things like that. Like, I can read it all in your guys. Because he's our family provider. So he said, I can look at Thomas's and tell you what happened with him too. So that was really helpful.